Good afternoon once again. So today we quickly want to look at angina pectoris. So we should define angina pectoris, and we will define it as a feeling of discomfort around the chest area, which is due to an inadequate oxygen supply to the heart. So angina pectoris is a discomfort in the heart. It can be a sharp pain or a progressive pain that has to do with what inadequate oxygen supply to the heart. So one of the major causes of angina will be short a lack of oxygen supply to the heart. Then there might be problems with ischemic heart disease too, which has to do with lack of oxygen supply or reduced oxygen supply to the heart, which may lead to what we call coronary artery disease. Angina can be a result of any of the following: atherosclerosis, which is the general narrowing of the blood vessels; spasm, that is contraction of some blood vessels; or thrombus formation, which would be something like a blood clot that dislodges and block a particular blood vessel. Now from here, we're going to look at the types of angina. We have the chronic stable angina. What are the features of this? Chronic stable angina is induced by stress or physical exertion, and you can cure this by just initiating rest. Once a person begins to rest, this type of angina will subside, or most likely you want to give a drug called nitroglycerin, which will also solve the problem. Now, the second type of angina is what we call the unstable angina. This type of angina is unpredictable because you will not be able to predict the onset, when it starts, the intensity of the angina, or the frequency of attacks that occur. Then the last type is the variant angina that can even occur at rest. So this variant is not even due to whether you exercise or not, or you stretch it, but it can occur anytime, which is caused by vasospasm, reduction in blood flow. Coupled with these factors here, these are the types of angina. Now, looking at the drug classes, before we discuss the drug classes, I would like to discuss the goal of therapy. So, would be the goal of therapy? The goal of therapy would be to prevent myocardial infarction, which is a permanent damage to that part of the heart muscle. Myocardial infarction, then the death of the individual involved. You also want to relieve angina pectoris symptoms by giving some of these drugs. Then you want to prolong life and improve the quality of life of the patient. What are the drug classes we could use to treat angina? They are listed here. We have the nitrate, also known as the coronary vasodilators. We have the beta blockers. We have the ACE inhibitors, the calcium channel blockers. We have statins, platelet active agents, and fatty oxidase enzyme inhibitors. So I'll start from nitrate. Nitrates are also called coronary vasodilators. What do? They induce relaxation of the peripheral vascular smooth muscles. Once you relax the peripheral vascular smooth muscles, you're going to produce dilation of the arteries and the veins. When they are dilated, you will reduce preload, which is the pressure and the volume of blood going towards the heart in the veins. Once you reduce preload, you also reduce myocardial oxygen demand, because the heart will be working lesser than it used to. Then by reducing myocardial oxygen demand, you would improve or increase myocardial oxygen supply. This would enhance oxygen supply to ischemic areas. These are areas that already have challenge with what? Enough oxygen. So what are the drugs we give here? The typical drug that is given is nitroglycerin. Usually they give it in an acute attack. You give it via the sublingual route or any other route, but you don't give it via the oral route, because this drug has about 10% bioavailability. So you don't give via the oral route. You can give sublingual or other, maybe transmucosal, intramucosal, or any other route. The other drugs are what? The amyl nitrite, the isosorbide dinitrate, or isosorbide mononitrate. Now, these drugs are given as for therapy, are also given for prophylactic use. Therapy means that in an acute attack, you can give what? Nitrate. For maybe in a case where you need to prevent it long term, maybe in unstable ovarian angina, you would want to do what a prophylactic. You want to give as prophylaxis. Now, what's up with the beta blockers? We know that the beta blockers will reduce myocardial oxygen demand by blocking the beta 1 receptors in the heart. Once they block the beta 1 receptor in the heart, you prevent the stimulation of the heart that comes from what? Norepinephrine or epinephrine. Then why do we give beta blockers? Because these are also necessary in therapy. You give them to reduce dependence on nitrates. You also want to reduce angina pectoris attacks. You also want to increase exercise tolerance because you expect the person to be what? To still be physically active. You will also minimize adverse effects that will come. The example of drugs you give here are maybe atenolol or metoprolol. You can give those. You won't give propranolol because propranolol is not cardioselective like this drug. The third drug class here are the calcium channel blockers. Calcium channel blockers will prevent the influx of calcium ion, so it will prevent contraction of the myocardium of the muscles. Also, they bring about relaxation of the smooth muscles. By doing also, this will lead to what? Reduction in myocardial oxygen demand. That is, you will reduce workload and you will increase blood supply, myocardial blood supply by dilation. So you inhibit smooth muscle contraction. Also, they do that. E.g., we have the amlodipine, nifedipine, the cardipine, felodipine, diatazine, or the verapamil. You could use any of these as in this treatment. The other group here are the ACE inhibitors. We know that ACE inhibitors are also used, like just like what we have in hypertension. We have them here, but they promote vasodilatation. How do they promote? Because they will now block vasoconstriction from the conversion of angiotensin 1 to angiotensin 2. They also inhibit platelet aggregation and thrombus formation. This applies to angina, but does not apply to really applies to hypertension. But they will reduce platelet aggregation and reduce thrombus formation. So, what are the indications for use? You can give this in maybe for a patient that has a coronary artery disease with diabetes mellitus, but the patient must not suffer from renal failure because this just might affect blood supply to the kidneys. So if you have the captopril, the enalapril, or the lisinopril. Now, after are these four classes, we have the statins, e.g. the lovastatin, simvastatin, pravastatin, etc. What do? They inhibit HMG-CoA reductase. They inhibit HMG-CoA reductase as well as they enhance, they inhibit they prevent the expression of LDL receptors. They prevent the expression of LDL receptors on liver cells. Now, we have the fatty oxidase enzyme inhibitor, e.g. the ranolaxin. This drug inhibits this enzyme. By inhibiting this enzyme, it modulates fat metabolism in ischemic areas and also help to reduce the workload of the heart. So the last group I think we should talk about will be the platelet active agent, maybe aspirin and clopidogrel. They will obviously prevent what? Platelet aggregation. So once you prevent platelet aggregation, you can prevent some of the problems that may occur in angina that may lead to what? Thrombus formation. So what another things to note here that angina pectoris require a modification of lifestyle, a modification of diets. At times you need to check the habits of the individual, the things they need to abstain from, as well as I find that then. You also need to improve their physical activities. So there are times that they may need to undergo some type of surgery, maybe heart bypass surgery, to ensure that what they don't die from myocardial infarction. So with this, we believe we have come to the end of this discussion on angina pectoris. Thank you very much.